They can cause sepsis. They can cause pneumonia. They are called as genus Pseudomonas. The most important among Pseudomonas is Pseudomonas aeruginosa. We shall discuss here certain general characteristics of Pseudomonas. They are gram-negative bacilli. They are saprophytes. They are found in soil, water, and moist environment. They are motile. They are non-capsulated. They are obligate aerobes. They cannot grow in the absence of oxygen. They are all oxidase positive. They are non-fastidious. They can grow in ordinary culture media, and they do not ferment glucose. There are certain pigments produced by this organism. These are pyocyanin, which is bluish-green in color, pyoverdin or fluorescent, which is yellowish-green in color, pyorubin, and pyomelanin, which are red and brown respectively. All the pigments are water-soluble and they all diffuse in the agar medium, unlike the golden yellow colonies. There are various factors which helps in this organism for its pathogenesis. First of all, the organism is saprophytic in nature. It can easily colonize on moist skin and equipments like cannulas, respirators, or endoscopes. It is resistant to antibiotics and antiseptics, so it can grow and multiply on these, for example in eye drops. The elongation factor 2, which is responsible for protein synthesis, is inhibited by exotoxin A. Antitoxin causes septic shock. The enzymes elastase and protease also help in its spread. The pigment pyocyanin damages the cilia in the respiratory tract and promotes respiratory infections. Besides this, the capsule or the slime layer prevents phagocytosis. The diseases caused by this organism are the urinary tract infections in the catheterized patients, respiratory tract infections in the patients with cystic fibrosis, especially the mucoid strain of Pseudomonas, and ventilator-associated pneumonia. Wound infections, especially in burn wounds and infections of bed sores where blue pus is produced, ecthyma gangreniosum where black pus is produced, and other infections caused include iatrogenic meningitis after lumbar puncture or LP, eye infections, external otitis, etc., septicemia, in which mortality rate is about 50%, and endocarditis in intravenous drug abusers. Coming on to a laboratory diagnosis of this organism, the specimen collection include the blood in case of septicemia, sputum in case of the respiratory infections, wound swab in case of the injury. The culture media include the nutrient agar in which large, opaque, translucent colonies are produced. McConkey's agar, they are non-lactose fermenters. Biochemical reactions include the oxidase test. This organism is oxidase positive. Treatment. Since this organism is resistant to antibiotics, antibiotic sensitivity tests must be performed. Preferred treatment is anti-pseudomonal penicillin or piperacillin or ticacidin and amikacin, gentamicin, aminoglycosides, and so on.